Well, hello, everyone, and welcome to this really special occasion where we are honoring the enduring legacy of a visionary in the field of peripheral artery disease treatment and education. The Global P.A.D. Legacy Impact Award is a tribute to individuals whose remarkable contributions continue to inspire advancements and shape the future of healthcare even after their passing. This year, we celebrate the extraordinary achievements of Professor Roger Greenhalgh, whose pioneering work has left an indelible mark on the field. His legacy includes significant contributions to PAD treatment through innovative research, the development of new techniques, and influential educational initiatives, especially through the most prestigious PAD conference in the world, Charing Cross, held every single year in England. Professor Greenhalgh's commitment to improving patient outcomes and advocating for PAD awareness has been recognized globally, influencing practices and education across regions. We are so honored to have Lord Stephen Greenhalgh, his son, with us today, who will receive this prestigious award on behalf of his late father. Lord Greenhalgh will share insights into his father's life and enduring impact on the field of PAD. So please join me in welcoming Lord Stephen Greenhalgh as we announce Professor Roger Greenhalgh, his dad, as the recipient of the Global PAD Legacy Impact Award through the PAD Impact Awards for 2024. Thank you so much, Lord Stephen Greenhalgh, for joining us, and thank you for being here to receive this, on behalf of your father.
It's an absolute privilege to be here to receive it. As you say, it's almost a year ago when my father sadly passed away. I think the person who reviewed his case after his death said he ran out of physiological road, but he had a great life, and it was a pleasure being his son. And I'm so proud that he's received this award.
Yeah, he's just had the most incredible influence on PAD care across the globe. And we're going to get into that in just a few moments. But first, I wanted you to share a little bit about who you are and how you are involved in the care for PAD.
Well, yes. I kind of grew up amazed at the drive that my father had. My first experience was meeting the vascular community as a 7-year-old, because my father won something called the Moynihan Fellowship, which meant that he raised the funds as well as received some funds to travel in the 1970s. And he literally traveled around the world with his family, his young family. And we met all the leading centers that were managing all forms of vascular disease, including peripheral arterial disease. And it was, he learned an awful lot by seeing the world's best at that time. And it became, that if I wanted to spend time with my father, I had to follow him around in the hospital. Christmas Day was doing a ward round on Boxing Day to see patients. And so naturally I became, very interested. Although I didn't decide to follow his path as a surgeon, I nonetheless wanted to work with my father. So I carry on helping organize his meeting after his death, which met successfully with over 3,000 people in London in April this year. But I've also had my own career of public service as both an elected and appointed politician. I was a minister in the government, recently served for 2.5 years, but also deputy mayor for policing and crime in London, and previously a local council leader, where a lot of the focus is on the care of the elderly and people in need. So I have had experience both in public service, but also in continuing my father's educational legacy. And it's been a privilege to have that journey with him.
Can you share some personal insights into your father's passion for vascular medicine and what truly drove him to make such significant contributions to the field?
Well, my background is in consumer marketing. And I think the thing that shone through my father all his life, and you see this in, I think, the very best doctors and caregivers, is he really cared about the patient. He wanted the patient to get better. And everything that he did, whether it was education, research, or particularly the management of his patients, was to do the right thing for them and do what was best and in their interests. And that's what struck me. And in fact, he learned from the very, very best about how to talk to and engage with patients in a way that gave them the best possible hope to get the best possible results. So, I think that's what struck me, was that relentless focus on getting people better.
So, what do you believe were some of the key factors that enabled your father to have such a lasting impact on PAD treatment and education?
Well, I think when we talk about this field, I think there are various things that drive progress, and education is important. It's important the community know and hear from the best about how to manage things. But two other strands I think are equally important. One is innovation, and being open-minded to try new things, I think, was incredibly important. And so my father was blown away by balloon angioplasty and met Andreas Grünzig, who came to Charing Cross, who died sadly very young in a plane crash. But he heard, as a surgeon, the impact of people like Charles Dotter, but also Andreas Grünzig, and PTA is still a mainstay treatment for so much of peripheral arterial disease, and so that openness to innovation, I think, is really important. And the last thing, which my father made his own, he led about a dozen randomized controlled trials, and that's evidence. It's no good having stuff that's new if it doesn't work. So my father was really relentless in wanting to show things worked, and that was his passion as someone to feel the studies that showed or didn't show that this was something that should be the best way of treating the patient.
And he not only conducted those studies, but he created the platform by which the evidence that he helped create and others created that would define the future care of PAD through Charing Cross.
Yeah.
Would you mind talking about the development
Yeah.
of Charing Cross, the most prestigious, I still think, the most prestigious conference for PAD in the world?
Thanks. Well, yes, he did. He was a very young man in his 30s, and started to have the ambition to have a very focused symposium on issues around arterial disease. And he was particularly, at the time, interested in things like the impact of smoking, which is obviously, there were far more people smoking then than there are now in the 1970s. So he looked at there's a focused topics of was what he did. And sorry, there's a bit of a noise in the background, but but anyway, yeah. So, but then that grew to become a bigger symposium, if you like. First from a 2-day focus symposium to a 3-day, then eventually a 4-day symposium that really covered all aspects of clinical management, and also became a huge platform for first-time data. So this year we had the Basel II trial presented for the first time. So it really evolved into what it is today, a global meeting focused on advancing the management of patients.
Yeah, I was going to ask how really has it evolved, since your father's involvement, and what aspects of his vision, still remain today?
Well, I think the thing that my father was extremely passionate about was that there was a dialogue, and that one of the aspects is that all the people that run the meeting today focus on engaging the audience, and that it isn't just an opportunity for members of the faculty to speak amongst themselves. My father always believed that there are loads of experts in the audience, and it was about that dialogue, if you like. I think that's very important. So you always draw active participation from both the online audience. Increasingly, so many people watch online, but also in the room. And the other aspect that's perhaps a little bit British, but still a great way of debating topics, is to have formal debates. So my father was one of the ones who pioneered the debate format with pros and cons to really tease out positions, if you like, and then take votes at the end of that I think was a very fun and novel format. And then there was obviously the relentless focus on new techniques and technologies, and showing how to deploy and use those as well. So it was a mixture of those things, but I think those two aspects, the audience participation and the debate. And the last thing that my father was famed for was he used low tech. So he didn't like people speaking over time. So he had a bell, and he used to ring his bell when people had used their allotted time. Even the most experienced presenters were kind of a bit nervous when the bell tolled. So he was ringing that bell brought matters to an end, and that was another unique act that I remember.
What I loved about the Sharing Cross conference was it did foster collaboration and conversation between not only doctors in the region but across the globe.
Yeah.
What role do you think that international collaboration has actually played in your father's work, and how did he foster those relationships above and beyond just that one conference in the year?
Well, first of all, you're absolutely right. If we look at the early 1970s when we went on that world trip, he described the mecca of vascular surgery being Houston in Texas because of both Michael DeBakey and Denton Cooley and what they did in the cardiovascular field. And I think my father was extremely influenced by leading American vascular surgeons of the time, both on the West Coast, East Coast, and in Houston, the Mecca. But he took a lot of what he learned and made sure that some of those practices found their way not only just in the United Kingdom but also right across Europe. My mother was Austrian, so he had a very much a continental focus, and he founded the European Society for Vascular Surgery, set up the board within the UEMS, which is essentially the EU structure for standards, and that was very important to him to have to, if you like, take some of the best things that he'd seen in the new world and bring them back to the old world. And the great thing about Charing Cross was that we constantly have a huge number of people coming to the meeting from the United States, but right across the world, as you say, from Europe and Asia, and it makes the meeting very, very special.
And I would be remiss if we did not talk about the ESVS, the European Society for Vascular Surgery, and the powerhouse that it is in influencing the care, the treatment of PAD. It is the go-to source for doctors across the region to guide them on the treatment of PAD.
Yeah.
And that was something your father truly played an integral role in creating and making possible today.
Yeah, well, he did. He essentially founded the society at the Charing Cross meeting in 1987. He became the first, essentially, chairman of the editorial board that then launched the very prestigious journal that the European Society has, the European Journal of Vascular and Endovascular Surgery. Yeah,
Mm-hmm.
And he used all his European contacts to create a truly European society that I think was in the image of the Society for Vascular Surgery in the United States, but it was important, as you say, that the region had a scientific society for the community to come together and create guidelines so that patients get the best possible care.
Yeah. And can you share any specific stories of how your father's mentorship and or leadership has impacted colleagues and students? Anything that has actually stood out to you?
Well, what I think is interesting, you look at did these people have a real impact, and what impact did they have on me personally? If I may give a personal example, that since his death, it's very, very recent, and one of the reasons why we were supposed to meet, to have this discussion a few weeks ago was unfortunately I was diagnosed with a blood clot in my leg, and this is so DVT, which and the DVT had got worse actually. The person that was managing me at the time was one of my father's last trainees, who's now a very successful venous specialist,
Wow.
called Ian Franklin. And Ian Franklin essentially realized I had a kind of episode whilst I was scanning my leg because I had some swelling in my leg. So this is very relevant for PAD, but it wasn't vascular problems. It was probably more cardiac problems. But I had, nevertheless, there was a kind of an incident whilst I was scanning this, and so he saw that that some of the clinical markers were raised and called for me to have a CT of my chest, and it showed that I'd had pulmonary embolism, which if you don't treat is potentially lethal. So
Yeah.
so it's that, and he used all the kind of diagnostic skills my father had, if you like, and it essentially saved my life. So I've got someone that is trained by my father, and in fact the lady who looked after me and gave me the treatment for my swelling in my legs they did something called the Charing Cross 4-layer bandage technique, which I'd heard my father develop and take to Charing Cross from his previous hospital, St Bartholomew's, and it's amazing to have his team look after me. And essentially, the person he trained saved my life. Because getting on those blood thinners was a way of dramatically reducing, the possibility of blood clot going to my brain or something else.
Wow. I mean, your father must have been speaking to you to get to that hospital in time.
Yeah, I was very lucky. But it was the people that he trained. And one of the things that his theatre sister said, well, not theatre sister, his ward sister, she's called Sister Angela Williams, and she's still working for Ian now. And she sort of said he was remarkably good as a brilliant diagnostician. So what she saw on the ward was his ability to diagnose what was wrong with a patient. And at the end of the day, that's what we need. We need doctors to have those very best skills to work out what's wrong with you. And as you know, in P.A.D, there are multiple reasons why someone can have the disease, and it's working out precisely what's wrong that's going to give you the best chance of recovery.
I love that you said that, because so many doctors will go in and they're just about, okay, we're just the plumbers, we're just going to treat it. But I love that you said that your dad was really all about the diagnosis of what's causing it. Let's get to the heart and figure out, for you as an individual, why are you presenting with this disease? And
Exactly right.
getting to the heart of it is really the ultimate. It gives the patients the best chance of actually keeping their limbs, because if you don't know why this person is, let's say, clotting, and those clots are ending up in their arteries, in their legs, and it is restricting blood flow in their legs, and you don't know, and you didn't bother to check, well, do they have factor V Leiden, protein S, do they have AFib, do they have an aortic aneurysm, do they have potentially even lung cancer? Like, where are these clots? Why is this person clotting? You're just going to keep going in there with this revolving door of treatments, and that with every single treatment, you're increasing that person's chance of having an amputation.
Exactly right. So that's the key thing. And one of the things that struck me about how my father ran his department and was that he designed everything around having the most effective and efficient way to diagnose the patient's problems. And that was very much key to the success of his practice, was having the skill sets and the tools to be able to make that diagnosis.
It's interesting. I wanted to ask you, what do you think your father would consider his most significant contribution to the field of vascular medicine? And I think that is definitely high up on my list.
For me, I think what you've done in terms of building that patient awareness and empowerment is phenomenal. And I think, that's how you measure, that's the yardstick by which we measure impact. It's, is this going to create and change people's lives? And I think that was what my father was able to do in his environment, but most importantly, through the platform of his symposium, touch practice around the world.
Yeah, no, he really did. And so how are you continuing to carry on his legacy, or how is his legacy, do you feel, being carried on, and how do you see that going forward?
Well, I want to make sure that we continue the educational platform of the Charing Cross. He was able to. I mean, the first thing Dad said when he was falling very ill and realised that he wasn't going to make it was, "Oh my dear, I'm not going to make my next Charing Cross." So it meant so much to him. So for me, as his son, I'm very keen to continue that educational platform. But he was able to select the people to succeed him. So he appointed the co-chairs that we have today. And also the executive board members so he was able to, if you like, decide who he felt was the people who were best placed to continue the work of the symposium. And what was very important to my father was that was an interdisciplinary team. And although he was obviously a vascular surgeon, in the leadership we've got someone who's an interventional radiologist, a vascular surgeon focused on venous disease, and then an academic vascular surgeon that's focused on aortic and peripheral vascular disease. So it's a mixture, if you like, of skill sets, recognizing that the subjects become very focused, and you need to have experts in the condition. So I just want to continue ensuring that his educational legacy continues, but also, this is one of the reasons why we got to know each other in the last year. I think he had a real mission around wanting to save legs, and he was aware that patients were not getting into the right hands. So part of that was the Hurting Leg campaign. And, I've had some health challenges, which puts things a little bit on hold, but I want to continue that kind of legacy, if you like, of helping to promote and ensure that patients get into the right hands. And there's a lot of work to be done, particularly in underserved communities, certainly in my country, and I'm sure that's the same in the United States.
It is. And we are committed to partnering with you on that and doing whatever we can to continue to make that happen for you, for your father, and for the people of England, and hopefully across the globe, that it could be the program that we work together on there could be replicated across the globe. Um, but what do you think your father would say about the current state of PAD treatment and research? Would he be happy with where we are at? Or would he, see serious gaps and say, okay, we got to fix this and this and this and this and this?
Yeah. Well, I think he'd be more on the latter. My father was never complacent about things, and always it struck me that and this is what we need more. We need people to think about the unanswered questions where there is an uncertainty about what to do, and to have the courage and drive to find one way or the other about what's the right thing for patients. And I'll give you an example. In peripheral arterial disease, we haven't actually shown the benefit of revascularization, of the angioplasty that we talked about, the Grinzig angioplasty, until my father did the MIMIC trials, in 2000, I think it was around 2008, so not that long ago. But and because you have other things that you do with patients with intermittent claudication who find walking difficult. You can do supervised exercise, there are medical therapies, but the benefit of revascularization was proved for the first time in those trials. And I think there are other unanswered questions. Some of the newer technologies, do they really make a difference? Are they something that are saving legs? And we need to get the evidence behind that, not just in single arm registry data, but in proper trials. And I think that was, how we're going to advance patient care. And there needs to be more of that level one evidence, I think. And he'd be at the forefront of doing that if you're alive today. And we need the clinicians of today to take that mantle forward.
I really believe in my heart of hearts that he would be doing exactly what everyone's calling for and no one is doing, which is to pit every single one of those atherectomy devices against one another, meaning those roto-rooting devices. And everyone says, well, we really don't know if they make the big difference. And then I would want to make sure that it would be done in an unbiased way without an agenda, except to truly figure out, do which one or do all actually have a positive outcome, for patients? Do they actually make a difference, in preparing the vessel prior to balloon angioplasty? And I really, maybe someone, will actually channel your father's energy and spirit and integrity and ethics and say, okay, we're going to do this. And it's not going to be a short-term project. That is a long-term project. But I think that that's critical for moving forward as we have innovation moving at the speed of light in this space. And I think more people are moving away from actually atherectomy and moving more towards lithotripsy, which I think is very interesting as well.
Well, that's right. And you use a phrase like vessel preparation, but there seems to be so many ways of doing it. And what we want to know what works and what's going to be the best for the patient. And I think that's important that's that we have those studies.
So overall, what lessons from your father's overall career do you think are most important for today's medical professionals to remember?
So a very good question. I say this as someone who didn't follow his path. I do believe it goes back to someone. My father he was dean of a medical school, and he used to ask people that started out why they wanted to be a doctor. And if they can't answer that in simple terms, basically saying, well, I want to help patients or I want to look after people, if there's not that element, then it's probably not necessarily the right career choice for them. So I think it's, you've got to get the right people for the right reasons following this path, because it's hard. People, all the doctors and surgeons that I know work incredibly hard. I came back from a meeting just recently, and someone who spent 2 days working really hard at the meeting was having to go back to the hospital to do a procedure that night, having flown in, having started the day at 7 o'clock in the morning. And that's That's the, so you've got to, in order to have that drive, you've got to have that want to make a difference, and have the right motives. So I think the motivation is important, and having just the drive to do that. And the thing I think that made my father very special was he had that drive to make a difference right until the very, very end.
Yeah, no, I love that. And I think that his legacy is carried on by so many doctors across the world that he has inspired through his work, through his conference, through the ESVS, and more. I want to bring in, we have our chairman of the P.A.D. patient network, and it's Douglas. He is located in Houston. He is a P.A.D. patient, and he is the chairman and represents all of our 12,000 patients across the globe. He wants to ask you a question, if you don't mind.
That's great. Far ahead, Douglas.
Great story. Great, great, great. I mean, that's some inspiration there. But I was curious. We've learned a lot as a patient. We've learned so much about what doctors go through because they have an amazing responsibility sometimes.
Yeah.
And as a patient, I have to do my part. I was curious what your dad might think about the two of us having to come together and what's it going to take for us to come together and really support each other in the advances that we're all going through.
Well, I think that's a great question, Douglas. And I think the first thing is that you've got to have that trust, haven't you? That and belief in between physician and patient. It's got to be there. It's so very important. And I say this as a way of showing how hard it can be. My father had his obituaries, obviously, when he died, and one of them was in the Daily Telegraph, which is one of our newspapers in London, and it talked about a time when his trial failed because basically the patients weren't telling the doctor what they were doing. Essentially, they were continuing to smoke, and the results were poor when they had the surgical procedure of the time, and you couldn't do that until you measured the carbon monoxide in the blood. And when you measure the carbon monoxide in the blood, you knew basically whether the patient was going to succeed or not. So I think you've got to create an environment where patients feel able to tell the truth, and then they can be supported more. And that requires a real trust between doctor and patient. And so that's the thing I learned from one of his research failures, because life isn't just about successes, but it speaks to having the ability for a frank conversation between doctor and patient. And if that's not there, you don't make the progress that you otherwise would.
Did he ever talk about the patient's role and how he educated the patients on their role as a partner in their care
Yeah.
to manage PAD?
Yeah, well, he did. He used to use, I mean, I remember catchphrases at the time as I grew up. And one of the things that was a catchphrase was, stop smoking and keep walking. So essentially, if you wanted to ensure your disease didn't progress to being limb threatening, and you wanted to overcome your problem, you needed to start walking more, and you needed to stop smoking, because that was the single biggest factor in whether you were going to get a positive outcome or not. And he did think about lifestyle, but he was always very keen to ensure what he didn't do was, I think, the worst aspects of physician management is when you kind of do procedures that won't last for very long, but you would then want to do another one and another one in 3 months, another one in 6 months. He wanted to do things that he knew were going to have a lasting impact on the patient. And but you had to work with the patient to plan that and make sure they had the best chance of success. And I think the other thing I took from him about how you work well with patients is you don't do the procedure, as you say, you're not just a technician. You've got to follow the patient up. You've got to have the relationship in the period after the procedure to know that it's working at 1 year, 3 years, 5 years, 10 years. And so the things that he did, I think, were around ensuring that his patients had a good outcome because he followed them up. He was interested in how they did. And I think that's a key part of the reason why he was very successful with it in his practice.
It's interesting because I talked to a doctor in the San Francisco Bay Area. I went on a tour and I was delivering donated step counter watches. And this one doctor, out of the blue, not knowing that you and I knew each other, said to me that your dad actually influenced his practice like 20 plus years ago, where he learned that the follow-up was the most important. So ever since he went to Sharing Cross. He had that conversation with your dad. He has been following up and following up with his patients, and he says he has patients that he's been seeing now over and over and over again for 20 years. He's seen
Yeah.
their kids grow up, their grandkids, and even in some cases, well, a couple cases, a couple great grandkids. And he said it was the influence. So it's amazing that I didn't think to bring this up sooner, but it was the conversation I literally just had on Tuesday with a doctor in Silicon Valley. The
Wow,
influence of your dad.
that's interesting, and I'm pleased that yeah, that comment triggered that. You've given the best possible independent endorsement of that was something that was second nature to my father. Continue that follow up.
It was amazing. I can't believe it just didn't come to the forefront
Yeah,
of my mind, this morning, and I was even
yeah,
thinking about it yesterday. So yeah, his influence, because I always say to, the doctors is that, you can't just do the procedure and then, not make
yeah,
sure that they're coming back. And the issue that we have in so many cases, I don't know about there, but I know here is the patients just no show on certain follow-up days.
yeah,
And they get one phone call or two phone calls, to the patient, and then they just give up. But what's interesting is the doctors that know that we have a relationship, and the patients that come from us to these doctors, the doctors actually follow up with us and they say, hey, where's this patient? Why haven't they come back? And we become this resource where they can't get a hold of them, but we can. And it's so interesting because in every single case where the patient has either no showed or they don't return the phone call of the doctor's office, they always return our phone call. They'll always return our text. And I ask, I don't understand. Why are you not returning their phone calls? Well, because we don't have an answer for them. Well, do you have an answer for me? I don't know what it is sometimes, with our organization and the relationships that we develop, with the patients, but they'll call us back, but they won't call the poor facilities back that are trying to reach out to them and actually offer them some help. So it's interesting, the
Well, it just shows
dynamics.
how trusted you are, and that you're making a real difference. That's important.
And I think your dad did too, for the patients to follow up with him.
Yeah,
I think it is pretty amazing, and I wish we could bottle that,
yeah,
that trust that they have and the faith that they had in him, which is so amazing. I'm sure people are still walking around today because of your dad and
yeah,
his love and his care and his skill set, not just his own skill set, but his teachings across the world and the influence that he's had, the millions of people you could almost imagine right now that are literally walking on 2 feet because of the influence of your dad. And that's why, we are honoring him with the P.A.D. Legacy Award for 2024. And if we could honor him every year, we would, because of his influence that we continue to see and the impact we continue to see, across the globe. I do want to ask you a few other questions, if you don't mind. And then I
of
have
course.
one final question about your dad. But we ask this of every single individual who is receiving an award, even on behalf of someone else. Number one is we have a series called Journey to Diagnosis. And this is really important, as you know, because so many people fall through the cracks of the system because of the lack of early diagnosis. And I want you to share the story of someone that stands out, that represents the grander trend of the lack of diagnosis that's happening and the critical need for getting these people diagnosed sooner, and the power of getting these patients diagnosed sooner. Do you have a case that you can share?
Well, I suppose the case that springs to mind is a case. I don't know if you had something in the States, but it's my father telling me this story more than I was there. But it was a case where a patient thought that they had an injury that they had a problem that was congenital, and the patient was explaining this, and it was assumed that, and it was being presented as a congenital injury, but actually it turned out that it was some form of arterial disease, and it was being misdiagnosed by the visiting professor. So and that was the person that my father then decided he had to work for, because this person was just so brilliant at working out the answer to the problem. So, that was very, very important to my father. So that was someone called Jerry Taylor, who was a professor in Barts, and my father became his chief assistant a couple of years afterwards. So, it's more that I know that the ability to diagnose was something that my father really rated and wanted to work with the very, very best in the field, rather than I was there when he was able to diagnose a particular patient. But that's, if you like, speaks to the thing that I know was important to my dad.
Yeah, no, I totally agree. And I love that. How about a case in which maybe you witnessed or you heard from your dad where there was a huge lesson that was learned by you or your dad, or and actually can still be shared, in which others can still learn from today?
Well, I think as we're talking about PAD, and we want people to say, we want the legs to be saved. I think it's kind of interesting that, and I'm just reminded of some of the great people my father met during his lifetime. And he got to meet, I don't know if you've heard of him, someone called Sir Douglas Bader, who was, there was a film called Reach for the Skies, and Douglas Bader was essentially a World War II ace in the Battle of Britain, who flew without any legs. He had artificial legs, and he flew. And he was this great name. So my father met Douglas Bader in the mid to late, probably the late 70s, early 80s, and at the end of his life anyway. And the thing that Douglas Bader communicated, this is someone who'd lost both his legs in a horrific accident before World War II, and was just how important it was to focus on what it would take to keep legs. So, as someone so that's what I think's really great about what you're doing, and what a lot of my father's practice was about, was what can we do to save legs? And that's from someone who lost their legs. Because yes, you can have a great life without your legs, but if you can do things that save legs and make those differences, it's a huge difference for that person's life. So, that's the kind of thing that strikes me is important about today, and what we can do to ensure that those patients get into the right hands and get treated properly and early.
That was beautifully said. What a great story. How about the 6 minutes that mattered in your career? The most defining moment in your career. Was it something someone said? Was it something your dad said? Was it something you witnessed? What were the 6 minutes that mattered?
Well, I guess it's interesting. I'm interesting that you've chosen 6 minutes as the time frame, but I think one of the things that I would say helped me was that the best possible clinicians sort of know what to do in the moment when when the patient needs their help the most, and then the operating table, and they know what to do. And I suppose politically, when I've had problems and issues, and you're at, let's say, answering a hostile question, I've had my father's knack, if you like, of knowing and thinking finding the time to come up with the right answer, even when there's a pressure of time. So what I think you often judged, aren't you, on how you respond in moments of high pressure, and do you behave in the right way? Do you deal with things in the right way? Do you handle the pressure well? And I think I learned that from my father, if you like, of how you stay very cool-headed and clear-headed. So that's probably the thing that's had the biggest influence on me. So, life isn't always a bed of roses. When things are difficult, that's when you need to have the right way of being able to respond. So that's the kind of something I owe to him, if you like.
Yeah, I love that. And before I ask you my final question, Douglas does have one more for you.
Sure.
Well, I was curious. Maybe this might be too personal, but how do you feel a lot of pressure following in your dad's footsteps and trying to separate what you do and what he did and carry on that legacy? Do you feel that pressure?
Not at all, because my father was the first person in his family, Douglas, to become a doctor and then a surgeon. And he didn't tell us to do that and follow him. He wanted us to do what we were passionate about. And my form of public service, if you like, has been, as a politician, and finding ways of serving in that way. And in my field, I've had my successes. I've served in a town hall where I live today for 6 years as a council leader. I've been a deputy mayor of the our great capital city, and I've also been a minister of state in a government. So I've had my success, and but it was never a yardstick of competitiveness or feeling that, I was very proud of my father. I chose to work with him, and was, amazed at what he did. But, we just had careers that have been on a sufficiently separate for that not to be a real factor. But sometimes he was known as my, Stephen's dad, and sometimes I was his son, and it depended the circumstances upon which we met people. And it worked very well. He was my best friend in life. So I've really struggled since his passing because I've lost my best friend.
Yeah. And I was going to ask you just, and we both lost our best friend, my mom as well, and still there are things that, I hear her, still a lot in my life. How do you hear your dad even still today? And in what moments do you still really hear him loud and clear?
Well, it's very interesting. That's a great question. I every time I was in a meeting today, and I was a meeting in the early part of the week, and I know the things that how my father would respond to things. So yes, I've always got his voice saying, "Oh, make sure you do this, and make sure you do that, make sure." So seek the truth. I kind of, the desire to involve, let's say, the audience. I mentioned that about the active participation between faculty and an audience. Whenever there's a session in one of our meetings that we help arrange where there's not enough from the faculty to, the speakers, engagement between the panel and the audience, I'm saying, well, my father would do something about that. He'd draw people in. So you kind of get his voice there. And yeah, and I always feel, I'm sure you do, they're still giving you advice, even if they're not there in the same way. We've had their experience, if you like, for all our lives, and they continue to whisper in our ears, as you say.
And as we close out here in honoring your dad, Professor Roger Greenhalgh, as the P.A.D Legacy Award winner of the year for 2024 through the Global P.A.D Impact Awards presented by the Global P.A.D Association, any final thoughts?
Well, I just want to say that I think what you've done in building up an organization that has 12,000 patients worldwide with the Global P.A.D Association, and to honor my father in this way, that's it's a real privilege to be able to receive this on his behalf. But I think, thank you for the work that you do to ensure that patients are informed, that they get the best treatment sooner, and we'll continue to work together hopefully in the future.
And the Global P.A.D Association acknowledges Professor Roger Greenhalgh, whose legacy continues to influence advancements in the treatment of peripheral artery disease and physician education. This award recognizes the profound impact that he had and continues to have on professionals and improving P.A.D care. We really thank you, and we thank your dad for everything that you and he have done and continue to do to provide a better quality of life for patients suffering from one of the most debilitating diseases that so many still have never heard of, yet impacts so many. Thank you from the bottom of my heart.
Thank you.